Measures are in place at South Africa's ports and harbours to test for the coronavirus. However, the state of readiness of hospitals to deal with the coronavirus outbreak in the Eastern Cape was earlier discussed during a media briefing. For an update, we cross live to our colleague Busisiwe Jemsana Mantashe. Busisiwe, a very good morning to you. Interesting times in our country, in the world. What came out of these discussions?
Sad times, Desiree, sad times indeed. That number of those infected by coronavirus keeps on climbing up, and just as we thought we were standing at 7, now new information that we are standing at 13, and the Eastern Cape forms part of the rest of the country and the rest of the world that is gearing up for any eventuality. And in fact, they are holding a meeting, a stakeholder meeting, to assess the state of readiness. And they've identified Port Elizabeth as their main port of entry, and they're putting up measures to make sure that airports are also safe, that they've got measures there. But Desiree, I'm not one who's going to be monitoring and making sure that all ports of entry in the province, and even when there's entry, God forbid, they will be able to put some measures. The MEC of Health, Cindy Swagomba, will have to be at the forefront of making sure that there are no people infected in the province. Oh, there's a limited number. MEC, thank you so much for your time. Interesting discussions that are taking place, though it's a closed meeting, but in the one presentation that we're able to get into, you speak of that there's a need for health practitioners to be trained. When will they be trained? Looking at the numbers and the province that gets infected and affected as the days go along.
Not necessarily getting trained, but rather conscientized. Conscientized as to the protocols and what to look for, in terms of the fact that coronavirus presents itself as flu or as fever, and that doctors must be able then to look at the different strains of fever and to actually be sure that it is the strain. People get tested, and that testing, as we say, does not exceed 48 hours. In 48 hours, we have results that are able to tell us what is it that we're dealing with. What we are then addressing, as we're discussing here, is the whole issue of saying, are we totally ready? Because now we have learned that people are able to escape the entry points into the country. However, they get to be sick already inside the country. And when that happens, they go to ordinary clinics close to them, to ordinary hospitals close to them. The fact that we've got 3 areas that are led by Port Elizabeth, that equally one of them is East London and one is Mthatha, does not necessarily mean that a woman in Mkanduli, a woman in Kamtobowa is catered for. Then it suggests that our own clinics, our own hospitals closer to where our people are, we should be on the alert. And in those areas, we should be able to create, whether it's a small space, just to isolate the person where we can, and ultimately quarantine them, whether we actually open a smaller Nyana ward, but at the same time, be quick to move them to areas that have got and are ready for the whole situation.
And looking at the Eastern Cape and the challenges it faces, especially where infrastructure is concerned, you are already dealing with hospitals that have got an overflow of people on a daily basis, on waiting rooms. How then do you act? When do you act? Because all those people will come presenting signs or symptoms of fever. When do you actually in a position to isolate those who you think are patients that are to be investigated, especially when we talk about overcrowded waiting rooms where everyone is coming to a hospital to hear how they're doing, if they've got fever or they've got coronavirus?
Thank you so much. But remember something, not all hospitals are actually open entry hospitals. Hospitals in that nature have got reception areas. From the reception areas, people are guided towards, even if it's a clinic, towards the area they're going to. Secondly, there are issues that are actually followed in terms of ultimately getting to suspect that it could be coronavirus. One of which is that the condition itself is by way of contact. So all those questions get asked. It's not a matter of assuming that people are in a waiting room and there might be infection, there might be people who are here. People are directed in hospitals. They don't just flock in one area. They go to specific areas that they're actually going to. So in those, immediately at a point before people are separated to their specific areas, those questions, if a person is found to be complaining of fever, that those issues will be asked as to contamination, contact, where, origin, and whether they've traveled maybe in the near kind of past as they now come to see themselves with that flu. Equally, the strain of the virus itself, it does have some symptoms that actually lead to suspicion that this could be coronavirus. And when you listen to the presentation inside, it said even if a doctor would want to take this person for an X-ray, that doctor would not send the person to an X-ray, but would arrange a portable X-ray to do that still within that area, so that that in itself is a minimal way of ensuring that the person is not actually walking around.
And from what you're saying, MEC, I'm imagining a situation where someone walks into a hospital, goes to the reception, they get asked these questions. Maybe someone at the reception identifies that this might be coronavirus, and they are then isolated to a separate room. But then it would speak to the issue of doctors. Do you have enough doctors? Because as is, doctors are battling to cater for the high numbers that come to their hospitals. Will you then have separate doctors who will be there to deal specifically with suspected cases of coronavirus?
When we started this debate, you were asking me about training, and I was saying what we are doing here is ensuring that both our doctors, our nurses, remember, a clinic does not have a doctor as a point of entry for an ordinary person in a village. It is a clinic, but a clinic is run by an OM. An OM and an advanced nurse, professional nurse. Those people should be one of those people that we are conscientizing as to understand, because it's not all cases that are going to come through a hospital. Some will come through a clinic. However, when people get to a hospital, the system is not necessarily that people are asked at the reception. However, as they leave the reception, there is an ordinary ward, which is a general ward, where people are then asked, as they get triaged, then they will be asked as to why they are here. However, at that point, that nurse must have an ability to raise the flag as to a suspicion, and that then suggests that there will be doctors, even if we don't have enough, who will actually be emergency doctors that will jump and look at what case is being raised and follow that up and take it up.
And after that, the process of isolation would then come into play. But do you have enough beds, enough rooms for patients that need to be isolated?
Remember, we said we've got areas of admission. It is not all hospitals that will actually admit. Then it suggests that you can incubate that patient, you can firstly move that patient to the nearest area in terms of the areas that we've identified.
Thank you so much for your time. Desiree, certainly a discussion that we will be following up with, and also visiting those hospitals. I know Livingston Hospital in Port Elizabeth, Dorangins Hospital, Frere Hospital, Cecilia Makiwane, and the Nelson Mandela Academic Hospital in Tata have also been identified as hospitals that have areas where they would have those separate rooms for patients suspected of having coronavirus. But as things stand, there's not been a confirmed or a reported case of a coronavirus outbreak in the Eastern Cape, and health officials continue to caution the public against spreading false viruses or suspected cases of the virus, as the minister is only one equipped to share that information, so as to limit the panic, as everyone is panicking at this point, not knowing what to expect or who would have that virus. But they're also saying, Desiree, that they have a team that has started creating brochures, that has started creating awareness, so as to educate the public more about the virus, so that they know the symptoms to look out for, and also know the prevention methods that should be applied, so as to prevent the scourge and the spread of the virus. So Desiree, it's back to you in studio right now.